What's going on, guys? Welcome back to W.D.Y.D CSP. What do you do as a central sterile processor? And this is part 2 of inspection and testing of basic instruments. Stay tuned, guys. All right, guys, so last week we covered the basic instrument hemostats. Now, I'm not going to go through every basic instrument because, like the hemostat, Alice's, Babcock's, Croker's, it's not about the identification that I want this series is about, but the series is more about the inspection and testing of the instrument. So regardless of what the instrument is, such as this one, this is a sponge stick. The inspection and testing is pretty much the same. You have the jaw of the instrument, the box lock, the shank, the rings, and the ratchet. Okay, now in this particular case, the box lock to the jaw of the instrument, so the actual jaw would be the whole length of this instrument, but the only working part or the working element of this instrument is the actual distal tip. Nothing happens along the way here. It's basically the holding part of the sponge stick. Now this is of a lower grade quality. I don't know if you guys can see that, but this is basically smooth. It doesn't have the ridges we're used to seeing. And some of our good quality instruments don't have them either. But it'll be indicative in the name of the instrument. But this is a veterinary instrument, so this is how they're made. But it still applies. You're inspecting the jaw for bioburden, for alignment. You're inspecting the box locks for any crack or bioburdens. All right. If you can see it on the video, that little pin right there in the center that you see, that little circle. Okay, you want to make sure that there's no cracks that come from there, because that is a common cracking point. The shanks, you want to make sure that they're even and not bent out of place. The rings intact, no cracks as well. The ratchet, make sure that they actually engage, and you're doing your functionality tests for function. All right, so we're gonna focus our attention away from that and come to this guy. So this is, again, a forceps style instrument, but more specific, it is a needle driver, a needle holder, whatever you want to call it. If you want to be specific with the name, this is a Mayo Hager needle holder. So the same thing applies. The jaw, the box lock, the shanks, the rings, the ratchet, you're doing a functionality test. You're inspecting for cleanliness. You're inspecting for damage. But there's something special about this instrument, and that is the rings. Those gold-plated rings are a identification of the instrument itself. Okay, not of the name of the instrument, but what this instrument has that another one that doesn't have the gold handles would have. And that is an insert that gives it a stronger grasp or a more secure grasp of the actual needle of the suture. All right, that insert is a tungsten carbide insert. You can tell because of the color, it has like a darker grayish color compared to the rest of the stainless steel. I don't know if you can see that in the video. It is bonded to the stainless steel. I'm not exactly sure how, whether it's an adhesive, if it's metal bonded by solder or whatever it may be. But there is a bonding process that occurs to place that tungsten carbide metal plate onto the actual jaw. As that jaw wears out, it can be taken off and replaced. So it is a repairable instrument compared to its stainless steel ring counterpart that once it wears out, it is no longer repairable. The inspection point with this is exactly that tungsten carbide. Although it gives it a better gripping because it's more abrasive, it's a stronger metal, but it's also a brittle metal. If it is used for anything other than its purpose of grasping a needle, such as prying a wire out or a screw, too much force is placed, it chips, especially at the distal tip where it grasps onto sutures. Any little chip in that tungsten carbide has a devastating impact to the function of the instrument as well as the safety to the patient, because those little chips can fall into the patient. Sometimes you can see it with the naked eyes, other times you need to magnify. This is where magnification plays a really big part with these inserts, especially towards the middle of it, where there can be hairline cracks. Depending on how it was repaired, if there's an air pocket left in there, just like a tile that's not flush, if there's a little pebble or anything under that tile and any pressure on it, it will crack down the middle. Same thing with these inserts. If they're not seated correctly, any pressure will cause a hairline crack that sometimes can be seen from the side of the instrument or even looking dead on it. But if not seen very obvious, that's where magnification takes place. Now this instrument here has a crack on the distal tip, but you guys won't be able to see that on video. I can see it with the naked eye because I know what I'm looking for, but under magnification, you can see that very, very good. Even when you put the instrument together, when you go to bite down, you'll see where the actual roundness of the carbide insert is not even with the other side. So that makes me look at that even deeper. The other thing you want to observe is the actual rings. I say that because this instrument in my left hand, right to you, is the exact same instrument as this one in my right hand or left to you. Okay, but this instrument's been repaired so many times and been washed and sterilized and processed so many times that the gold has faded to the point where it looks like a stainless steel counterpart, but it's actually a tungsten carbide instrument. You can tell when you open up the jaw and reveal the tungsten carbide in there. All right, so this instrument is the exact duplicate of this one here. It's just the gold has faded to the point where you can no longer see it. Is the instrument usable? Yes, it is. But for identification purposes on the field, a surgical technologist does not have really the time to look at the jaw and say, oh, that's a tungsten carbide. They look at the actual rings and be like, okay, well, the doctor needs something with a secure grip or one with not so secure of a grip. So having this on the field will make it seem like it's not a usable instrument when in fact it's the exact same instrument. So if you see something like this, I personally believe that it should be taken out of circulation and done. If it can be replated, then replate it. If not, substitute it with one that can be easily identified. All right, guys, join me next time when we talk about our friends, the retractors, and we can do some special inspections with that. What's so special about retractors? Tune in next week and check it out, guys. All right, as always, stay true to yourselves, keep it 100, and peace.